Hello, this is Elon Johnson coming to you, Imaging Department, and today I will be speaking to you via this video in reference to gender versus sex. The difference in gender versus sex: gender is more cultural and social. It is how people see themselves, how people feel within them, not how they were born, which would be biological, which would be their sex. Gender and sex have nothing to do with one another. There are people that feel like they were born in the wrong body, and they feel as if they are in fact the opposite sex, and they identify as that sex. That would be gender. And sex would be what we learned in school many years ago, about the women being XX chromosome and the men having the XY chromosome, and that men are the ones who determine the gender of a baby, not the mother. A woman can only have a female child because she only has the XX chromosome. Okay, so that's the biggest difference. Is gender is how one may feel, it is cultural, it is social. Sex is your anatomical body parts. It is your genitalia, it's the chromosomes, and it is biological, not how you feel, which that would be gender. And there are biological differences in men and women. Men tend to have heart failure due to coronary artery disease, and myocardial infractions are greater in men than they are in women. Women are pretty catching up, but not quite the same. Also, there is greater hypertension in young men than in young women. However, that reverses once women get older and we lose our estrogen. We then tend to have a greater risk at hypertension than men. Men tend to be stronger than women, and that's due to their androgen. They have less estrogen than women. However, we both have androgen and estrogen within our bodies. Men tend to be larger, they're more athletic, they are also more psychotic, and tend to be much more aggressive than women. Women tend to be less aggressive, more humble. We tend to comply or conform much better than men. We are comforting. Women are sensitive. We tend to gossip more. We tend to smile more. We also tend to have greater depression. So females have greater depression than men, but men are more psychotic. If you look at Ted Bundy, Charles Manson, Hannibal Lecter, they are psychotic. They could went off and killed a lot of people, when women tend to be more depressed, more to themselves. You could look at Girl Interrupted as far as depression, the movie Sylvia as far as depression, and American Beauty is another movie that references depression in women. We differ in medication as well. They have found that medication, the doses that typically are for male, don't quite work so well for females. They are also finding out that we do not metabolize, females do not metabolize medication the same as males, and that is causing differences. There was a study regarding Ambien, and it was found that Ambien didn't metabolize in women as it did in men, as it does in men. Sorry about that. And that they'd wake the next morning and they'd still have the dose within them, which made it difficult for them to function when they rose the next morning. So there's a metabolism difference there between women and men. Men tend to be a little more antisocial than women. They tend to have that antisocial personality disorder when women don't. But again, our brains are different. They function differently. There are chemical balances and imbalances that are different in women's brain versus men. Pharmaceutical companies are now coming to the realization that they must do more studies on women and find how medication differs from gender to gender. And that is something that is being worked on and is important to not only the pharmaceutical companies, but it's also important to the doctors that they prescribe their female patients the correct dosage, being that most studies in this world are done on males or even on male rats versus female rats. So they're not really finding out how things tend to function with the female versus the male. Also, when we mention gender, we must think of the LBGT community. As I was stating that I have a cousin that is female and has a wife, and their community has a lot of concerns because there are people that are now transgender, and transgender individuals are not getting the same health care as male or female that identify as male and women that identify as women. The biggest problem that they're having is society sees them differently, and doctors don't quite know how to prescribe medication. If they prescribe medication for the gender they're identifying as, or the gender they were born at, or the sex they were born into, or the gender they're identifying with. So it's becoming very difficult to address the health issues of transgenders, and they don't tend to seek health care like others because of financial burdens, discrimination. They are uncomfortable at how people see them, look at them, and they don't understand them. They have a high risk, transgenders have a high risk of HIV infection, more so in women of color. They have a high drug and alcohol abuse because of the stress of being transgender, not knowing where they actually fit in or belong, or we as society seeing them as differently when they're not. We're all human. We all bleed the same. We were all birthed by a mother. So we are all the same, but they feel differently because of things that they've gone through and have experienced: harassment, people disregarding them, still calling them by their birth sex versus the gender they identify with. A lot of transgenders are using hormone replacement, which can cause issues in itself. In radiology, say for instance in mammography, you can have someone who identifies as male come in and you have to get a mammogram on them because in actuality they have breast tissue. So we must in fact do a mammogram on them as we would any other female. But we must remember they identify as male, so we will treat them as a male, respect them in that way. There are a lot of gynecological issues in the transgender community, as well as they're not getting their cancer screening. That's the biggest issue with men in that are transgender. However, there are some new approaches coming about. There are town hall meetings that are now taking place. These town hall meetings are bringing transgenders in from the community into meetings with medical staff, and they want to find out, the doctors want to find out their concerns. The doctors want to help them, and by having this meeting and asking questions, having those questions answered on both sides, by answering questions on both sides, we will eventually be able to better treat transgenders. And I mean, this world is loving and accepting, and we should treat them as we would want to be treated because they are us. It could be you, it could be me. The biggest thing for them is to feel as if they are okay and that their concerns are being met, that we are handling their health issues, and that we are being respectful with that at any and every time. I hope this little speak here, this little speech, sorry about that, these braces tend to get the best of me, but I hope this little conversation that I had with you gives you a little more insight on the difference between gender and sex. And again, gender is biological. I'm sorry, gender is not biological. Gender is how one identifies, and sex is biological and anatomic. Thank you. Bye bye.